And tonight, some brand new information about testing students and staff inside our schools.
As districts try to minimize the virus's spread and avoid going back to virtual learning, we know one way to control COVID-19 is finding cases through testing. More than 40 days ago, Governor Doug Ducey announced 2 million rapid tests were coming to Arizona with a focus on schools.
But all new at 6, ABC 15's Nicole Grigg is learning the state's largest county is still trying to figure out what schools will use them.
100 million rapid point-of-care tests will be given to states and territories to support efforts to reopen their economies and schools immediately and fast as they can.
President Trump promising millions of rapid tests in September, and a day later, Governor Doug Ducey saying on September 29th that delivery would be 7 to 10 days with a focus on K through 12 schools. But these tests were quick to be sent out without a clear plan. Last month, we found out that these tests are not as simple as they seem. There are concerns about who would administer them because not every school has a school nurse, and these tests are supposed to be done inside of a lab setting, so that means that schools would have to get a special waiver to give them. Maricopa County has been working on a plan, and we're learning not every school district wants the tests inside of schools. 16 school districts will partner with Banner Urgent Cares to administer the 15-minute test. Districts like Scottsdale, Fountain Hills, Osborne, Glendale Elementary, and Paradise Valley districts are some. 3 other districts will partner with the county health department to find nearby vendors, and 8 school districts will choose to administer the tests on site. Those districts include Murphy, Cartwright, Phoenix Country Day School, and Dysart Unified.
We would like as much information, as accurate information as quickly as possible.
Dysart Unified is one that's considering going the testing route inside schools. They say they will decide by Friday if they want the nasal swabs in their schools to get results in 15 minutes.
You know immediately that classroom needs to get disinfected today. We need to make sure they're distancing and clean that immediately. So yes, we believe that it'll provide a little bit more information, a little bit quicker, that allows us to do a little bit more.
The county telling us these tests would just be for those with symptoms, not for mass screening all students and staff.
Where it is very useful is when, for example, a student presents to the nurse's office with symptoms that look like they could be COVID-19. You can then make some immediate decisions about whether to send that student back to the classroom or not.
Will Humble, the state's former top public health director, says the test will possibly help trace other potential cases and isolate people quicker.
If you have some contacts in, for example, a friend group of a positive known case that was infectious or likely infectious at school, and you have the rapid test, then it would be a useful tool to test those contacts.
Now, the schools that do decide to do the testing inside of the schools, they will also be responsible for reporting positive and negative cases to the Department of Health. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.